Hello, everyone, and welcome to the 12 Days of Cortisol Christmas. My name is Winslow Dixon. I am the CEO of Adrenal Alternatives Foundation, and I am so excited that today we're going to have Dr. Megan on to answer all of your questions about steroid side effects and how to manage them. And so shortly, she will be joining our broadcast. So while we wait for her, I just wanted to kind of come on here and give you guys a little bit of background on her. And then once she joins, I'll be moderating the questions that you have for her. So Dr. Megan has been a volunteer with us for many, many years, and she is known as the prednisone pharmacist. And so what that entails is, and if you've Googled her name or seen anything, her whole practice is about educating patients on steroids. She herself had a condition that required her to have steroids to stay alive. It's not the same condition as us that are adrenal insufficient, but nevertheless, she was told that she needed to be steroid dependent to sustain her life. She had a condition where her blood platelets were not correct, and so she would have to take prednisone, or she would have severe bleeding, and it was just a really intense thing that impacted her life. So through that experience and through seeing how difficult it is when everybody's telling you steroids are so bad, this, that, and the other, and just seeing the trauma that she had to go through that, she and her educational background was able to find ways and tools and create resources to help people on the long-term steroid journey. And that's why she's been a godsend to not only, myself, but also many people that are facing, long-term steroid use. We all know as adrenal insufficient patients that steroids are just a part of our lives. There is no, just take it, one day and not the next. It's really imperative that we have cortisol replacement every day. And as we've talked about many times on this page, it's not only the right dose, but it's also the right timing and the right steroid for your body. So we're going to do a lot of more educational things on that in the year to come. But for today, Dr. Megan is going to be answering your questions. So when she comes on, we will be very happy to answer any questions that you have. Like I said, Dr. Megan is very experienced in this field. Her website, you can just Google Dr. Megan prednisone pharmacist and a myriad of things will come up. So I'm very excited that she agreed to come on to our platforms and help us. So I will try to keep the chat boxes active and see if there are any questions. Let's see. Like I said, we are awaiting Dr. Megan and her joining us. There's I think the time change and the time difference kind of, got all of us, but she is on her way. And I will look forward to moderating the questions for you guys. And so I am able to look at the chat box now. So if you comment anything, I will be able to see it and I will be happy to moderate for you. And so while we're waiting on her, let me just tell you about a couple more of the things that we have going on this week at the 12 Days of Cortisol Christmas. So Monday's event, which is December 5th, I am ecstatic about. It's going to be December 5th at 2 p.m. on this Facebook page. And what we're going to be doing is doing a live demo with Julia Anthony, who is the founder of Solution Medical. And we are demoing the TwistJect cortisol delivery device. And for those of you that don't know, there has been kind of an EpiPen created for cortisol. And it's this amazing device called a TwistJect. And so it's going to take the horrendous 15-step process of the current ActoVial system down to a very streamlined pen that you just take the cap off, you inject, and it's an EpiPen essentially for cortisol. So we will be live demoing that on Monday. So be sure to tune in for that. She'll also be answering questions. And so we will be able to find out everything we need to know, where it will be available, how it will be available, those sorts of things. So I'm very excited for that. And then we also have some really cool interviews. There is a musician named Vinoj, and he's actually created an adrenal anthem called Temple to Castle. And you can find it on YouTube. I have posted it to our Facebook page and I think also our Instagram. And this song is an anthem. If you've ever dealt with Addison's disease, adrenal insufficiency in any form, you will resonate with this song. And the title of it is Temple to Castle. And it's basically talking about how, adrenal disease can be a fight and it tries to take you down, but you just got to fight. You got to make your temple strong. You got to make it a castle, and you got to just make yourself a fortress. And it's just this really good introspective song. So on Thursday, December 8th at 5:30 p.m., we will be coming live on the Facebook as well. And we will be talking to Vinaj about his story and about why he created this song, and him just sharing how he uses his music to not only be an outlet for his own struggles, but to also encourage others. So we're very excited for that. So tune in Thursday, December 8th at 5:30 p.m. EST to hear Vinaj. And then we will also be having our 12 Days of Cortisol Christmas Adrenal Trivia. And I'm really excited this year because we have created this really cool trivia sheet that you can go and download. Go to adrenalalternatives.com/adrenal trivia, and you'll be able to download your trivia sheet. And then we're going to come onto the Facebook Live on December 12th, and we're going to be talking about those trivia questions and give you a chance to answer. And there's a bonus word that you have to find, and it's going to be really fun. And so the way that you can enter to win prizes, and we have a lot of prizes from a lot of our sponsors and from also our adrenal store. It was really cool stuff. So if you want to enter to win, you just take a picture of your completed sheet, your completed trivia sheet, and then you can just post it to any social media and tag us, and that's how you'll be entered. So please join in for that. That'll be December 12th, and we're really excited. And you'll also be able to enter, even if you can't make it that day, the 12th, it will be available for playback on our YouTube and also on our Facebook until December 31st. So just as long as you get the answers before December 31st, we'll be able to put you in the drawing. So I see Dr. Megan is here, so I'm going to admit her into the Zoom, and we will be able to answer your questions shortly. Hi, Dr. Megan. Thanks. Hi.
Hello.
Thank you so much for joining us.
I'm so excited to be here.
I was telling everyone about your story and about how you came to understand the struggles of adrenal insufficiency and all those sorts of things. So if you want to expound on that, you're welcome to.
Yeah. So I was just a normal pharmacist going along, only seeing, the pill side of things, when one day suddenly I had to take prednisone, and it changed my life forever. So yeah, that's how I got into this, is having to personally take it.
Yes, and we are so appreciative that you turned your struggle into strength. And so we wanted to just open up the floor to anyone who may be watching about any questions that you had regarding steroid management. I know we've talked a lot about, there's a lot of things that come with steroid side effects. So as we wait for questions, do you want to kind of expound on the top complaints that you get from your patients?
Definitely. Okay. So the number one thing people can complain about publicly is usually sleep. And so like the top Twitter complaint is insomnia. It's like, you can complain about it because it doesn't reflect poorly on you. It's like, I can blame the drug completely because I wasn't like this before, right? And so people are so frustrated about the sleep, and it's usually the worst at higher doses and everything. And you sometimes get used to it the longer you're on prednisone, but not always. So people who have adrenal insufficiency, it's like this lifetime lack of quality sleep, right? And so what can you possibly do? And I was staring at the ceiling one day, trying to take a nap and failing to do so. And I realized that while people know, and by people, I mean like pharmacists and doctors who prescribe prednisone, know that it causes osteoporosis. And so therefore, everybody should take calcium and vitamin D. Nobody's mentioning the fact that prednisone and other steroids like dexamethasone, hydrocortisone are actually depleting melatonin too. Melatonin is your sleep hormone. They call it the vampire hormone. It makes you want to fall asleep at night. When the sun goes down, melatonin goes up, and you're not making as much of it if you're on steroids. Like your body does not make as much as it normally would. And so if you have been struggling with sleep and like constantly feeling fatigued and maybe cranky, maybe you don't have enough melatonin in your life. And so that's a super simple, natural way to give back what prednisone is stealing, is to take melatonin every night.
Absolutely. And I love that you talk about, how your body has to have a rhythm. And I think there's not enough education on how, when you don't have correct cortisol, you end up having this disruptive circadian rhythm. So can you elaborate on how hormones play a big factor in your circadian rhythm?
Yes. Okay. So hormones are all affected by prednisone, whether it is your metabolism hormones like your blood sugar, or whether it's your sex hormones like progesterone, estrogen, testosterone, whether it's your thyroid hormones like levothyroxine, or whether obviously your cortisol hormones, the whole cascade of hormones in the HPA axis, starting up at your brain and it goes down. And there's this whole series of hormones, and they're all being interfered with. And so cortisol is normally high in the day. So like if the sun is rising, basically cortisol is rising, right? As the sun starts going down, cortisol starts going down. And melatonin is usually the opposite. Let's pretend like it's like the moon. And as the moon is rising, then the melatonin comes and then it gets lower as the sun starts. And so if we do the whole 24-hour cycle, the cortisol goes up and then goes down, and then the melatonin starts and it's up while cortisol is down, and they're just opposites. And so when you're taking that prednisone, that cortisol replacement hormone, it's going way higher than it normally would. Like normally it's like this in a normal human, but with cortisol replacement, you're going like this. And there's just not enough melatonin being made. So you're always a little in a sleep deficit of quality, restful sleep.
Exactly. And like she said, there is a natural circadian rhythm that our bodies do. And when you have adrenal insufficiency, you are trying to replicate a body system. And so I want to make that distinction that when prednisone is used for rheumatoid arthritis, for inflammatory diseases, though it disrupts, like she said, the cortisol, it's different because they still have working cortisol. We do not. And so we are completely 100% replicating this working, fluctuating body system. And so that's why it's very imperative. I think the initial thing you need to do when you're on steroids is make sure that you're on the right dose and the right time. Because like she said, cortisol has what's called a cortisol awakening response, the CAR. And so like she said, you have this gradual curve throughout the night where it starts to rise, and then it will kind of peak and then it will go down. And so you have this natural curve. Well, when you take adrenal insufficient drugs, steroids, you don't have any through the night. And then all of a sudden you have 20 milligrams and then you take, this, and it's this whole day of like, and that disrupts, like she said, so many hormones. And so I think, if you're working with your endocrinologist and you're not getting proper sleep, it's so imperative that you talk to them about proper dosing. Circadian rhythm dosing is the key to quality of life. So can you expound on what that exactly means, like circadian rhythm dosing?
Yeah, so circadian rhythm is just trying to mimic that curve through a more smooth dosing system, instead of just when somebody takes prednisone, essentially what happens is it goes straight up and then drops off fast. And then hopefully it's steady throughout the day, but it usually isn't. it usually drops off really fast, and then that's it for the day, and you don't have anything else. Whereas if you take hydrocortisone, we started over here, right? So you be up high, and then you drop, and then you take another dose of hydrocortisone, drop, and then another dose, and then drop. And it's not like a curve. I guess I can't get my lefts and rights, but it's supposed to be a curve. That's what your body normally does. And so finding a way to get as close to that curve as you can is the most natural way our body is used to it. And so what I love about adrenal alternatives is you give us options. Like before this existed, I didn't know there was anything else aside from taking a pill or like going to a compounding pharmacy and having them put the powder in a capsule and have it sustained release over time. That was the only options I ever heard of. So this is options that are fantastic for this community.
Yes, thank you for that, Dr. Megan. So we do have some questions. So she says, this question's from Jennifer. What if I'm already on melatonin? Should I up that dose?
Yeah. So the thing about melatonin is everybody's different in the amount you need. Some people, 0.5 milligram makes them super drowsy the next day. Other people, 5 milligrams still isn't even enough. And in the studies, they've gone as high as 20 milligrams. So you can go anywhere from 0.5 to 20 milligrams. So it's really going for you. Like in that range, what is giving you restful sleep and avoiding waking up feeling drugged and drowsy?
Yes, and I will put to that, there are a lot of options for melatonin. I personally use a melatonin spray. I'll put the information on it in the comment section when I find the name, because I honestly don't remember, but I'm very sensitive to it. And so one squirt, I'm good. If I take a tablet, it tends to be very strong for me. And so you have to work with what your body is. So I would definitely start out at the lowest dose and then see, and, like Dr. Megan said, there are many options. There are like melatonin, there's a supplement.
Dissolving tablets, gummies, like just normal tablets. I mean, it goes on and on.
Exactly.
So many.
So I would start out low and then just see how you tolerate, because you want to be able to get a restful sleep, but you don't want to be in this groggy, overhanging state the next day. So when I find that link, and I'm sure Dr. Megan has other brands that she recommends, she actually has a big thing which she'll recommend at the end of this. But okay, so next question is from Amy. I am on Lovenox for life. Lovenox, yes. Sorry for that. Never seen that before. I'm on Lovenox for life. How does this mix with my steroids?
Ooh, now that's tricky because prednisone, a side effect that most people don't know about, that is permanent, lifelong, you can't do anything. It doesn't go away after stopping prednisone, if that's an option for you, which isn't usually an option in this community, but is heart disease complications, whether that's high blood pressure or stroke, heart attack, pretty much anything to do with the heart can be worsened by prednisone. And Lovenox is a medication used to thin the blood, usually because you've had like something like a stroke or a blood clot or a pulmonary embolism or something where the blood wasn't the right consistency for some reason, and we're trying to thin it. That's what Lovenox is. And so prednisone is increasing your risk of usually thicker blood, not usually thinner blood. So if your doctor is aware of both medications, then it might be okay. If your doctor is not aware, then I would definitely be making them aware, because it does make things more complicated. So whenever you're hospitalized, whenever that, people need to know you're on Lovenox and prednisone in combination, definitely.
Absolutely. And I just want to, make the disclaimer as well that everybody is different. And we had a comment here about, melatonin causes a negative reaction, and that happens. So everybody's different. And so we're saying, don't go out and buy whatever, you have to work with your medical team, listen to your body. Like I said, melatonin, I'm very sensitive to it. If I take a pill, I'm not good. But if I do the spray, I'm fine. So I just want to put the disclaimer that you have to work with your medical team. And the reason that we love Dr. Megan so much is because she has so much education on prednisone and steroids and their effects that a lot of primary care physicians and even endocrinologists don't have. And that's why her website is so amazing, because she has all these things and these links to these studies that I don't think are common knowledge. And that's not to knock doctors, but I think that long-term steroid use in the case of adrenal insufficiency is different. Because like I said, if you're treating an RA, if you're treating some sort of inflammatory process, you're not replacing a hormone. So essentially, it doesn't really matter when you take it. But with cortisol replacement, I want you guys to understand that you're replicating a body system. It's not just taking a pill. So I will definitely put the links in here for our information on circadian rhythm dosing. We had a question here that says, is there a natural rhythm to take hydrocortisone? And so I'll let you answer that one, and then we'll get to these others. So is there a natural rhythm to take hydrocortisone?
Yeah. So the best way is to mimic your cortisol rhythm. And that's the highest in the morning and getting lower and lower until about dinner time. And then it should be going off. And so the best is to take your highest dose first thing in the morning, like when the sun rises, essentially. And then a lower dose midday and an even lower dose after that. It really depends on so many things. And that's why I'm going to actually let you answer how we can actually mimic that better.
Okay, so the first thing with steroid replacement that's vital is knowing your cortisol metabolism rate. And I just want to point out that each of these steroids have a very different half-life. And so a blood serum half-life is basically, it's a big complicated pharmacokinetics thing, but it means when it works, how long it stays in your system. So hydrocortisone has the shortest blood serum half-life, okay? So that means it's gonna have a peak duration quicker, but it's gonna go out of the blood quicker. And so if you're on hydrocortisone versus if you're on prednisone, you're going to need to dose more frequently. And so everybody's different. And there are patients that are actually hypermetabolizers. And what that means is sometimes there's a deficiency of cortisol binding globulin, and I won't get into all technical stuff, but there's a lot of factors into how your body processes steroids and cortisol. And this is the case even in non-adrenal insufficient people. Some people just burn through it quicker. And so it's important that you know your body's cortisol clearance rate. Well, how you do that? Your endocrinologist can actually do a cortisol clearance test. And basically it's where you go into like a lab or, even your doctor's office if they have phlebotomists, and you can have them draw your blood, and then they'll inject you with cortisol, and then they test it every 30 minutes for about 2 to 3 hours, sometimes 4, to see how your body's holding on to it. Any doctor's office can do that. There is a protocol on it, and I'll put those links as well. But that's really imperative. So that's a baseline thing of making sure that you're on the right steroid. Like Dr. Megan said, there's prednisone, which is a longer acting steroid, which means it has a slower peak, but it also got a longer duration. Dexamethasone has the strongest of all of them. It has the longest half-life. And it's mainly used in CAH patients because their cortisol things are a little different. But baseline cortisol deficiency, you need to make sure that you're on the correct one for yourself. And so once you get that piece figured out, you're going to want to, like she said, mimic what your body does. So with me, I am a hypermetabolizer and my body's just wired a certain way. So I actually take my highest dose at 4 in the morning. I know that sounds really irritating because nobody wants to get up, but if you think about the cortisol awakening response, your body has not produced a whole lot of melatonin throughout the night, and then it starts to elevate at like from 2 to 4 in the morning. And so if you start your day early, you need to have enough cortisol built up in your system, because what happens is if you take your dose, say you have to be at work at 8. If you take your dose at 7, you're going to get ready without cortisol, and you're going to be burnt out before you ever get to your job because you don't have the blood serum half-life to get through your day. So it's all about timing. So think about when you have to wake up. If you have to be at your job at 8, you probably need to be taking your cortisol no later than 6. And then depending on how your day is, if you work second shift or something, you might be able to do it. You basically want to cover when your body is going to need cortisol And that's going to change depending on your lifestyle, depending on your cortisol metabolism. So I just want to stress that everything is so subjective, and there's no body that can come to you and say you need it at 8 and at 4 and you're going to have to figure that out. So we highly recommend that you keep a journal, look at everything that you're going through, that maybe certain things trigger it, and we'll get to the food aspect of it. But there's certain things that can increase your need for cortisol, and so you want to make sure that you're getting an accurate dose at the right time. So like I said, if you have to be at work at 8, you don't want to be taking your cortisol and doing things and not have it in your bloodstream when you're supposed to be functioning. You need to take it at 6. That way you can get going. If you have tablets, put them by your bedside, put some water there, get it like a cracker. Don't ever take steroids on an empty stomach. I don't care if you can handle it, you can't. Like Dr. Megan can tell you that too. Just take it while you're laying down, let it process 30 minutes and then get up. That will make a world of difference, I promise you. So any comments on that, Dr. Megan?
I love that advice because you need some cortisol to help you get out of bed. I do actually have one fun fact of the day. I was taught exactly what you just said about do not ever take prednisone without food. That was like the gospel truth I was taught in pharmacy school. And then as I learned more about prednisone, I actually discovered that, whoa, no way, is that actually not possibly the complete truth. There's actually a potential explanation for this. And it is that a lot of people who take prednisone also take ibuprofen or naproxen or other NSAIDs along with it. And when they do, that drug interaction causes the GI problems, the like ulcers and issues, stomach upset, reflux problems somewhere in your gut lining is actually a drug interaction between prednisone and NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen is the most common one. So if you are not ever taking ibuprofen, then potentially you can't take it without food.
Okay.
Yeah.
Well, you heard it straight from the doc. So, like we said, everybody's different. So really pay attention to the medications you're taking. And like she said, there's interactions that you don't even think about, because if you're in pain, you pop an Advil, whatever. And when you're on corticosteroids, there's added factors to a lot of things. And so, I would highly caution you, keep the drug interactions checker on your phone. And before you take something, really look into it. And maybe there's an alternative that you can find. We're obviously adrenal alternatives. So there are a lot of, I think, alternative things that can really help with pain, GI upset, and those things, because Pepto-Bismol has, I don't know how you pronounce it, the salicylates or whatever. Is that how you say it?
Salicylic acid.
Yeah. And so that really irritates me. And I don't know if that's like a steroid thing, but I don't think you're supposed to take stuff like that while you're on corticosteroids. And I didn't know that. And so I'm having all these stomach issues. I'm drinking Pepto-Bismol, and I was having more and more issues, and that was fueling it. And so I think it's really important, as a steroid dependent community, we need to have more conversations about these things, because there's really not much research. And I will put the links to Dr. Megan's website, because she really has everything I've ever had a question about is on her website. And that's one reason you can ask her. When I first talked to her, I was like, oh my God, I need you, because I was struggling. And the only thing I could ever find was on her website. And it's because she's been through this, guys. Dr. Megan has been on the other side of it with the puffy face and then not having energy to take care of her children. She's been here. She knows. And so she has a compassion that other healthcare providers may not have. And that's not to bash them, but I always say that, would you rather have brain surgery done on somebody who's taken 8 years of courses on it, or somebody who's never had a class on it and done 5 of these brain surgeries, And I feel like that's kind of the mindset that we need to have, is that these doctors might be telling us things that they know are gospel truth that we've been like, I've been there, done that, bro. It ain't right. So Dr. Megan's website, I highly recommend you check out. But we're going to answer another question. So she says, what can I do in case of brain fog?
Okay, so brain fog is a definite side effect of prednisone and other steroids. Like, if you're ever wondering, am I just losing my memory? Am I just confused? Am I just getting old? No, it's the steroids. Like, it's not you, it's the steroids for sure. So just to put that at rest, like at the very least, step one is, oh, it's not me. Like, I can accept that it's not me. So once we've gotten that piece that it's not my fault, it's not my genes, it's not what my choice is, it's the fact that I'm taking a drug, then we can move on to brain fog can have lots of causes potentially, and some of them actually might be nutrient depletion. So I've mentioned calcium, vitamin D, and melatonin, but there may be other nutrients that prednisone is stealing. And the scientific literature shows at least 9 and possibly 13 or 14 nutrients prednisone is stealing. And several of those are really important for brain health and memory and focus. And when they're like stolen, depleted from your body, then we are as if we are like a plant that used to be a green, lush, flowing, strong plant that is just wilting and yellow because we don't have all the nutrients we need. And that's what brain fog feels like. And so when you give those back, it perks you back up, you feel good again. And brain fog can also be caused by a lack of good sleep. And so if you're giving back that melatonin, getting as many healthy habits that controlling as many things that are in your realm of control as you possibly can help you get as much brain function back as possible.
Absolutely. And I just want to add to that I don't know, most people don't know this. I didn't know this until I really got into research, but the adrenals actually produce neurotransmitters. So there's this, they're called adrenal catecholamines, and you can Google that. Dr. Megan, do you want to explain those a little bit better than I can?
Basically like adrenal, like adrenaline, like that hormone your body releases in an emergency, like you're trying to run as fast as you can out of there, or like you're having an allergic reaction and you need adrenaline, like adrenal, like there are lots of hormones like that your body releases to deal with stress. And so that's just one example. I'll let you keep going.
Exactly. So there's adrenal catecholamines, which can affect GABA, serotonin, all these things. And so those are in your mind, right? And I have found that when you don't have the right cortisol at the right times, you're in this, like she said, you're kind of like a wilting plant. Like, you're still alive, you're fine, but you're like, I call it, it's terrible, but like, it's low cortisol crazy. Like, for example, I was low the other night and I looked at my husband with my cup of water and I was like, make this more. I could not think of like, can you get me more water? I was like, make this more. And that's what happens because your adrenals, cortisol does so much in the body. And if you couple it with the nutrient loss, with the exhaustion that we all feel, and let's face it, guys, when you're cortisol deficient, everything is harder because you're not only having to say, oh, I've got to do this, I've got to push myself, but you're trying to figure out a dose that makes you able to do that thing. And also with cortisol deficiency, you can do the thing, but then not have enough cortisol to recover from the thing. So you might think, oh, I did good today. And then you go to bed that night and you wake up feeling like utter garbage. And you think, what did I do? Well, you did that thing. So again, it's so imperative that you get the right dosing, because if I have cortisol, I have brain cells. They are good. If I don't have cortisol at the right amounts, I have 4 brain cells and
Amen.
3 of them have left and they're not talking to the other one. And the other one's having a panic attack because it's all alone and doesn't know what to do. So again, just make sure that you are writing everything down. Keep a health journal. I'll put a link to one that I have that I've used. It's so imperative because you don't know a lot of things until you start writing it down and you think, oh, I did that. And that probably caused a little bit more cortisol because you don't think about it because, we're strong people. We live with this. We just do it. And I think it's important that we put those things together. So as far as the brain fog, I would first assess your cortisol dosing. When are you getting this wacky brain fog?
Yeah.
And then also you can test, all this stuff, and we'll have more on that when we release it. But there are ways to check this stuff. It's common. I'll elaborate that on more at some point, but for now, talk with your doctor. Say, look, I'm a potato right here. Like, I'm an educated, cool person. Like, I can't talk, I can't think. Something's wrong. I can tell you, as someone who has had bad cortisol dosing, I've been on a pump, I've been on injections, I've been on literally every steroid on the market and some that are not even on the market yet. Okay. And there's a huge difference when you're not if you have brain fog every day, something's wrong. So,
Yeah.
and like I said, at the end of this, Dr. Megan will talk about vitamins and things that she recommends, but that, yeah, I would say you're not on the right dosing pattern.
I have to completely agree with that, with the dosing, because one of the symptoms of prednisone withdrawal / adrenal insufficiency / not enough hormone in your body is you feel like you can't get off the couch, complete fatigue, brain fog. You feel like you got run over by the bus, potentially a fever, headache, joint pain, muscle pain, all of these things that sound a lot like the flu, but it's actually just you don't have enough cortisol, get some more now.
Exactly. And like you just brought up tapering. So we do have a lot of questions on that. And this is something I really want to talk about. And I guess I'll take this question because I am adrenal insufficient, but it says, what's the difference between tapering and low cortisol? Here we go. Here we go. Okay, so this has never been talked about, and I'm so frustrated that it's not really recognized, because whenever you go to an endocrinologist, typically they'll tell you, oh, you're on too much steroid, you need to drop it. Well, first of all, if anybody ever tells you that before they've done labs on you, tell them absolutely not. And that's not being ugly, that's not being mean, but if you're assuming something based off of no evidence, that's crazy. And they might say, oh, well, wait. Well, the thing is like, diabetic get very similar care than adrenal insufficient patients, okay? Except instead of insulin, we need cortisol. Well, what's the difference there? They would never go to a diabetic and say, you're overweight, you need to be on less insulin. No, they would check an A1C and they would look at their glucose reading. That's standard procedure in endocrinology. The only reason they don't do that with cortisol patients is because it does not exist yet. But right now, there is no way that they can go, okay, your cortisol is good. Weight gain is not always because you're on too high of a dose, and we'll get into that a little bit later. But I want to point out that as someone who has done steroid withdrawal on every steroid possible over so many years, when I was first diagnosed, I was diagnosed after an adrenal crisis. I became severely disabled, couldn't put pants on, couldn't, it was horrible. I was on oxygen, and they just kept giving me more and more and more steroid. And they had me on fludrocortisone 3 times a day. Okay, I ballooned. I gained 10 pounds every week until, it didn't stop. And then I finally took control of my health. So at that time that I was like, I'm done with this, I was on 100 milligrams of hydrocortisone and fludrocortisone 3 times a day. Now I gained weight. And when I tell you that I ate raw squash. That's all I would allow myself to eat because I saw the weight and I couldn't stop it. So when it comes to tapering, if they are trying to taper you without a blood test, tell them no. And I'm not trying to start a riot, but they would never do that to a diabetic patient. And they only do it to us because they'll say, well, that's not really done. It needs to be. We need to start having these conversations and making these endocrinologists be accountable. And again, I'm not being mean. I understand that they were taught a certain way, but these protocols haven't changed since 1940. Okay. And that's wrong. That's bad. We need to set accountability. So that's my first comment to that, is if you've been told your steroid dose is too high, they need to test you, and they need to test you extensively. Quest Labs in the US has a test that's a 6 specimen lab. It's covered by insurance, and even if it's not, it's very inexpensive. I have this done periodically because I want to know what my steroid dose is doing. There are also some at-home protocols coming that we will announce later. But for now, if your doctor says you're on too much steroid, you say, okay, well, let's do the 6 specimen lab at Quest. You go to Quest. It's not fun because you're there for 6 hours, but they test your blood and your cortisol levels for that whole day. If that comes back high, okay, we need to taper. All right, so what's the difference between low steroid and withdrawal symptoms? So I've done both, like I said. Low symptoms are going to be discomfort. You're not going to feel great. You're not going to have a lot of strength, but it's not going to be unbearable. Okay. As someone who's done both, like I said, when you get into crisis, you start getting the feelings of doom. You're over emotional. you have stomach issues, you're in pain, like when it gets unbearable and you're like, I can't do this, that's more than tapering. That's more than withdrawal. Dr. Megan, do you want to kind of explain what withdrawal symptoms are?
Yeah. Okay. So I think the most important thing to understand is actually the difference between adrenaline insufficiency and prednisone withdrawal. And I didn't really get this until I thought of Pac-Man. You know that game, Pac-Man, where there's the little guy who's shaped like he's like round here, and he like goes through a maze that's black and white and like total old school video game. And there's these little dots that he eats down the maze. And so he's going along and eating the white dots. And I'm going to pretend like those white dots are cortisol. And this little dude is your glucocorticoid receptor. So if your glucocorticoid receptor is happily eating cortisol, then, and like the ratio of Pac-Man to cortisol is appropriate, then you're set. Like you have no withdrawal symptoms. And so if we have too much white stuff, too many little white dots, too much cortisol, too much prednisone floating around, steroid in our system, and not enough Pac-Man to eat them, that's the symptoms of high cortisol. And maybe you might have too much weight gain or moon face or that type of thing. And we want to get it in the right ratio. And so we want the right ratio of Pac-Man to this. Now, if you suddenly drop your dose too much, Pac-Man is not happy. He doesn't have anything to eat. He's starving and he's just sitting here waiting. And the thing about Pac-Man is he's on every single cell in your body. Some cells have way more than others. Some cells only have one, some have hundreds. And it all depends on how important they are in your like survival response. And so when you take prednisone, you make more receptors to compensate for the amount of steroid floating in your body. And so the ratio gets better. And as you taper, which means you're decreasing your dose, say you're taking 20 milligrams a day and you go down to 15 milligrams a day, you still have the amount of receptors on your body to use up 20 milligrams a day. So then suddenly you're only giving it 15 milligrams a day. And this one might have something in it and it's happy, but this one's wide open and it's saying, I'm empty, I need something now. And that withdrawal, pain, need, angst is what I was describing earlier. The severe joint pain, muscle pain, extreme fatigue, stuck on the couch. That is prednisone withdrawal. Then there's adrenal insufficiency, which is where you're not making the cortisol, right? And so when tapering, the goal is to go slow enough that your body can break down these things and put them back into your system at the appropriate rate. And for some people, you can't break these down fast enough. And you have to taper so slowly. Other people, they're like, I have the wrong ratio, break, and everything's okay. It's every single person's different, because when a steroid hormone goes into a cortisol receptor, do you know what happens next? It goes to your DNA. Everybody's DNA is different. So there is absolutely no way to standardize tapering, to standardize dosing, to standardize anything, because that next step is your DNA and everybody's is different. And so you need to find where your ratio of steroid to receptor is appropriate for you and you alone. You're avoiding those symptoms and avoiding as many side effects as possible. And it's a tricky balancing act.
Absolutely. And like she said, everyone is different, but I've done withdrawal, and withdrawal is uncomfortable. Withdrawal is going to cause pain, but it's never going to send you into that. Well, I'm not saying never, but when you go into adrenal crisis, we all know your mind goes, you get very weepy, you get overstimulated. That's not withdrawal. Withdrawal is discomfort, withdrawal is pain. Withdrawal might be you're extra moody, but that distinct feeling of doom and unbearable pain, that is crisis. And so There are ways to taper that they don't tell you about. There's a stair-stepping method. And okay, so standard tapering is you might drop the dose and just like, okay, so let's say you're on 5 milligrams. We'll split it in half to 2.5, and you just take that for a week. And there's actually a better way to do it. And like I said, I'm not a doctor. This is just personal experience. You have to talk to your doctor about this. But there's a method called the stair-step method. And it's basically where if you take 5 milligrams, let's say if you take 5 milligrams at 2 p.m. So Monday, you take your regular 5 milligrams, 2 p.m. Tuesday, you take a 2.5. Wednesday, you take 5 again. And then you basically every other day. So you're slowly getting your body used to that lower dose. I have withdrawn from benzodiazepines. I have withdrawn from narcotics. I have withdrawn from a lot of things. Just I've had a lot of health issues, and we have another question about that I'll address in a moment. But all of those were easier than steroid. And the difference is when you're adrenal insufficient, your body recognizes this is a chemical that you need. And so if you drop below a certain point, it's going to start sending out signals. If you're vomiting, if you have an unbearable headache, if you lose your eyesight, if your blood pressure goes low, even or high with secondaries. And I want to make that point too. If you're secondary, your blood pressure can go really high because you've got different norepinephrine stuff because you're secondary and yours is pituitary. But anyways, if you are feeling those severe symptoms, you're going too fast on a taper. Don't be afraid to stair step. And I know that a lot of us are, oh, I wanted to lose weight. A lower steroid dose does not mean you're going to lose weight. Okay. I want to make that very, very clear. I have cut my own dose down 15 milligrams. I've not lost a pound. Now, mind you, a lot of you have other factors. We have a lot of comments here where people say, I have this and this and this and all these other conditions. We need to start looking at our health as a whole picture. Like this other lady said, she has other pain. Well, how do you tell if you have adrenal symptoms or other pain? And so this is where that journaling is going to come into play. So like we talked about, you're replacing a body system that's supposed to be natural to do it itself. You're doing it artificially. So if you have symptoms that show up and then go away, and then show up and go away around your doses, that's a cortisol symptom. Get a health journal. I will put links to one here, but that's imperative. And you talk to your endocrinologist, talk to your prescriber. If they're trying to pressure you to go lower when you're physically not ready, you need to have a lot of stuff tested while you're doing it. Have them continue to test your cortisol levels. Have them test your, inflammation levels. I mean, do you know if you even have positive ANAs? Like I think a lot of times with adrenal insufficiency, there's more than just one thing going on. So it's very imperative that you have that.
Yep. And then on that note, I have a free downloadable taper chart that you can print out, and it's on my website, and it's super easy. Like I have every tapering plan out there, whether it's like the 5-day taper, the 5-week taper, the 5-year taper, basically. Like there's the dead slow, and it's like every other day strategy. It's all there. So you can just choose which one works for you, print it out, and start tracking it.
Exactly. And I'll also put those links in the description of this video when it's posted. So like I said, there's so many resources that I don't know why they're not mainstream, other than we're told this disease is rare. They don't test for it, but that's a whole nother video. So let me answer this question. So this question's from Debbie. She says, my son has Addison's and he's only 19. He was diagnosed after a crisis nearly killed him. My problem is getting him to do his medication regularly and why he needs it every day to function. He's on 20 milligrams every day. So this mom is concerned and she wants to know how to convey to her son that he needs it to function. You're a mom, so I'll let you take that one.
Oh, goodness. You don't want to know what just happened in my house this week with an antibiotic. Okay, I'll tell you. My child was prescribed an antibiotic and it was like the worst tasting thing in the world. And I gave up after 3 doses. I was like, I just can't. The liquid was horrid. And I'm working on getting a prescription for the tablets because this child can swallow tablets. So I totally understand. You cannot make anybody do anything. But when people understand why, it makes a huge difference. So My child isn't quite old enough to understand the why. But when people get that our cortisol is designed by Mother Nature to save us from life or death situations, and if we don't have it, we may die. That's kind of potentially motivating. It's not just life or death, it's general stress, whether that's trying to take a test, whether that is trying to deal with the loss of a loved one, whether that's moving, whether that's going through a divorce. It can be emotional, it can be physical, it can be any kind of thing that's hard to get through. We need cortisol to deal with it. And so if we're not replacing that steroid, it's miserable. And I felt the exact same way because my disease, the reason I took prednisone is called ITP, and it's an autoimmune condition where my immune system was attacking a part of my blood called my platelets, and I was at risk of bleeding to death. But my risk of bleeding to death was almost the same as my risk of other side effects from prednisone. And so it was like, which is worse? I can't decide, the prednisone or bleeding to death. This is horrible. I hate this so much. And I mean, I don't know, is now a good time, Winslow? This is why I invented a supplement, and it's called Nutrinizone. And I invented it to give back the nutrients that prednisone depletes so that when I had to take the prednisone, it wasn't so awful. Like before this, it was either take the prednisone and suffer side effects or don't take the prednisone and die, right? Like those were the options. And either way is awful. So then you give this back and suddenly it tilts the balance in the favor of prednisone being an awesome treatment and you don't suffer as much. So like, it's the best of all the worlds. You give back everything that prednisone steals, and now you can cope with the side effects and you can get the benefit that you absolutely have to be getting from the prednisone. Like I had to take it so I wouldn't bleed to death, right? Like I had no choice. Same with people on who have adrenal diseases. You have no choice. You have to replace it. So what can you do? You can give stuff back. And that's why I invented Nutrinizone.
Exactly. And, I know we've all been in that same mindset of, I don't want, like, what's worse, the treatment or the disease? And so I would say, as far as this question with her son, I've been there. I've had moments where I look at my body and I look at the scars and I look at, like she said, everything is taken from you. And you just think, I don't want to do this anymore. And it almost sends you into a panic attack. You're like, I can't do another day. Especially on those mornings when you wake up low cortisol, you're like, oh, this again. But this is why we are here as an organization. I have this horrible thing, and I have tried to find everybody in the world that can help this thing. And we're not here to make money. We're not here selling a product. Dr. Megan works hours and hours for us, and she's never gotten a dime. And we're not here being like, oh, buy this. No, she takes this herself. She, has this, and I have about 10 bottles of those. I'll send it to you for free for our shipping. Just let me know. I will send it to you because this is about quality of life. And so, with that question about her son, this is a battle. I mean, this is a battle between life and death. And I hate to be that dramatic, but we were given the task of managing a body system that's supposed to manage it for us. And we're not always going to be smarter than the adrenal gland. I never am. And I think it's important to just relate to your son that, one, you're not alone. There's really a huge adrenal army out there, people that will come beside him and just let him know he's not alone. There's plenty of, young men that actually do have this condition, so if you want to contact us, I can set him up with a really awesome advocate that I know wouldn't mind. So I just want to, encourage anyone, if you have children with this condition, I know it's hard to watch your kid, but this doesn't have to make your life unlivable. Is it difficult? Absolutely. But there are options and there are things, and there's a whole lot more that I can't wait to announce. But right now, Dr. Megan has these supplements. We're having, Julia come on Monday about the twist jack, the injector, like of all the times in history to have adrenal insufficiency, now's a pretty good one. So we just have to kind of, I guess, look at the positive. And I know positive thinking doesn't cure things, but it does make you feel better. And so I think we have to just get into a positive zone. I was diagnosed at age 23, very young. I actually had to quit school. I was going to be in the medical field, going to be a physician's assistant, and I had to quit because I couldn't walk. And I think we all go through this dark night of the soul. You know, Dr. Megan did, and she was diagnosed with this thing. She's a young mom with kids, and she's like, how in the world can I do this? So I think we just have to surround ourselves with a mindset of this is an army of people battling the same thing. So that's what I would say to that. And I'm going to get to one more question here.
And then I just wanted to say, I will ship this to you. All you have to do is pay the shipping. Like, I will give you this. People spend $99 every day to buy this, a month supply of all the nutrients you need. But because it's the 12 days of cortisol Christmas, I'm donating these to anybody in this community. You keep it secret. You don't tell the rest of my people because they're paying full price.
This is an adrenal exclusive.
This is an extreme, seriously, I'm completely serious. This is adrenal exclusive. No one else gets this. All you have to do is pay shipping, like $7.99. That's exactly, like, actually for some people who live far from my warehouse, that's actually more than it cost me to ship it to you. I mean, it cost me more than that to ship it to you. So $7.99, you get this, a whole month supply, and for free. Merry Christmas.
And we will put all that information in the description of this video. So we do have one more question. I am having a breast reduction this Friday. Do you have any advice for dealing with steroid management? There's actually a link that we have on our web page. Our website is like under construction right now, so I do apologize. Oh, it told me my site's going offline. Sorry. I will actually post the download to this because I do have it on our drive. But so if you're having a surgery, and Dr. Megan can echo this as well, it's imperative that your anesthetist knows that you're going to need IV steroid before, during, and after your procedure. There is, like I said, a downloadable tab that I have on our website. Now it's under construction, but I'll put it here. It's imperative that you get IV Cortef before, during, and after your surgery. Anytime you ever go under anesthesia, you need to have 100 milligram vial of Cortef administered with your anesthesia. Okay, Megan just sent me the taper chart. I'll put that in the chat, and I'll also find this other thing. But as far as that goes, absolutely ensure that you are getting IV Cortef. Do not go under the knife without that. I'm not saying that to be dramatic, but it's imperative. And make sure that they are aware that you're going to need increased steroid after. I don't know if it's an inpatient or outpatient that you're having, but you're definitely going to need steroid coverage. So be sure that you have that. Like I said, there's a printout that we have on that, so I will make sure to make that available. Again, our website is we're transitioning, and I'm really excited to announce all the things that are going to be on it, but it's not up yet. So Dr. Megan sent me that in the chat, and I will put it on our video here on Facebook, and these will also be available on our YouTube channel as well, which is youtube.com/@adrenalalternatives. So you guys can find that. Like I said, we're talking about a lot of things that aren't talked about, and frankly, I'm tired of it. And like I said, not to have a bad attitude, but when you're in this demographic and when you see how much people are really suffering, and there are so many things that aren't talked about. So let me review all these other questions here. So Dr. Megan, a lot of people are asking how to get your supplement. Do you want to explain that?
Yes. So I was just editing my website really quick because I said $7.99, but it currently says $9.95. So I'm fixing it so that it's even cheaper for you, because that was paying for hosting the website in addition to the shipping. I'm literally only making you pay the shipping. And I don't know if anybody knows, but shipping gets more expensive around Christmas time. So like, that's the only reason, is because it's even more expensive than usual right now. So anyway, I'm going to send the link, drop the link, and I'll bet you can email it out to people probably, maybe.
Yes, we will definitely put this
but
in our
do
newsletter.
not share this with anybody. I'm
Adrenal exclusive, folks.
only adrenal people. That's it. only adrenal people, not all of my other people. I don't want them to know. Okay, this is for you alone because I volunteer on this board. And so I'm going to get this all on here, set to go, and I'm going to get the link, send it to Winslow. We'll put it in the chat below.
Yes, I will make sure that you guys have every bit of this information because, like I said, Dr. Megan, I was her patient before she ever decided to join us because it's a wild journey when you have adrenal insufficiency. And I worked in the medical field. Like I was going to be a physician's assistant. Like I was in school and everything. And the doctors, even the coworkers that I had, they were just like, well, I don't know. And I kind of got tired of the whole, well, it's just not done that way. And then the more and more I started researching, this has not been updated since 1940. And what's interesting is they'll say, do what?
It's so wild. Like there's
Yeah.
a disease like this that there's literally been no updates.
Yeah, and I think, having come from the medical field and like I had never heard of, I probably had one course on endocrine stuff and they're like, oh, this is really rare. You'll probably never see it. You know why we never see it? Because nobody tests cortisol. I think it should be standard in emergency rooms, but that's another fight for another day. But anyways, I just want to champion you guys that it's time that we have these conversations. It's time that we stop accepting this poor, subpar care. And like I said, it's not that they don't care. It's just that they've been taught this is something rare. You take a tablet, you go back to your normal life. And that's not the way that it is. And there's a gradient of this disease. Some people do great. Some people, especially those that are diagnosed at birth and those that have never had an adrenal crisis. But the statistics say that if you're diagnosed post-crisis, like 90% of people, and the study is on our website, have reduced quality of life. And it's because when you go so long without those cortisol, things that Dr. Megan talked about, your body's literally starving for something. And so I think it's really important that we have these conversations. We start making, medical professionals accountable. This is not something that is some weird, rare phenomenon that never happens. There are millions of people. I have the exact statistics in my office of how many people have these conditions. And I think the mistake that we make is that we separate ourselves into subgroups, Addison's disease, CAH, Sheehan's, but together we are a cortisol deficient community and there are millions of us. There are millions of us. So my objective, as we go forward with this organization is we're going to get every resource to you possible from anywhere in the world with anybody that we can work with. This is not about money. This is not about, whatever. Our entire team is volunteer. Nobody gets paid. We're rebuilding from Hurricane Ian. Like we're in this thing now. And so I just want to encourage you guys that it's going to be okay. We're going to make sure that you have what you need. And we're going to get you every possible resource that we can find. There's a lot of stuff coming that I just can't wait to announce that I know is going to really make things better for all of us. Because I don't think it's fair, how we've been kind of forgotten. And so I'm going to look through these questions, see if there's anything else. Okay, if you cannot afford shipping on Dr. Megan's thing, comment or send an email to adrenalalternatives@gmail.com. We will sponsor you. Like I said, this is not about money. This is not about, us trying to sell a product. This is life, people. This is where we are choosing to not accept the negative narratives that we should take a pill and be fine. I know that's the case for some people, and I wish it was the case for all people, but it's not. That's why we have so many of these resources available to you. Other things that we have, we're going to launch an entire gallery on our website, which is going to have downloadables. We have things where you can go to your local EMS and make sure that they're aware of how to handle an adrenal insufficiency situation. We're working with other organizations to make sure that we eventually want every state and every county to allow EMS to administer Cortef. So that's something that we're heavily working on. We're also in the Rare Disease Congressional Caucus. And so we go before our legislators and we tell them, what needs that we have as a company, as a demographic, and we're really trying to make sure that all our bases are covered. We have a lot of, technology things that are coming down the pipe that I can't wait to announce, but better days are coming. So I just want to reiterate that you're not alone. It may seem really impossible, but it's not. So, Dr. Megan, did you have any other things that you wanted to mention?
Well, I've got the link. I'm going to drop it right now so you can get it. It's literally nutrinize.com/checkout/free. So there it is for Winslow to drop into the Facebook chat. And all you have to do is fill out the form. And it's going to just charge you only shipping, and you're getting basically $100 worth of supplement for free. Like, Merry Christmas to people who need it most, like the adrenal alternatives community. You're the ones stuck on prednisone for life. And so here you go, a free month's worth of everything you need. So people might be wondering, like, how does it even work? So we've got this morning bottle, and the morning bottle, you're going to take 2 in the morning. And then we have the bedtime bottle, and you're going to take 2 at bedtime. And the reason we do that is because, first of all, we have the calcium. And the calcium, your body can only absorb 500 milligrams at a time. The rest, you're just going to like poop it out. Like, you cannot absorb it. It fills up and everything else just goes out. And so we need to separate our calcium doses. Even if you choose not to use this, no matter what, everyone on cortisol replacement medications need to be taking calcium and vitamin D. Like, that is standard of care for everyone. Calcium and vitamin D. And so you have to be taking those 2 doses of calcium separately. Morning and bedtime is, in this case, is what we're doing. And then, in addition to the bone support, I also have ingredients in there that help with the weight. So one nutrient prednisone steals almost as much as, or maybe even as much as, nobody really knows for sure, they haven't really tested, is chromium. And chromium is this metal mineral that you absolutely have to have in order to use your insulin and sugar properly in a little matrix. And prednisone is making you pee it out. And so you can't use your sugars right. And that makes you crave sugary foods, eat more than you should, and get diabetes, high blood sugar. All of these things are consequences of the chromium being lost. And so when you give that back, just imagine how that's going to help you with your weight and your sugars, all of those things. So that's the second thing. And then there are 2 more ingredients that help with your weight. And then we have the bedtime bottle right here. Where are you? This cannot do right and left. The bedtime bottle. It has melatonin in it. Like I was mentioning earlier, how melatonin is the opposite of cortisol, and you're no longer making it as much as you used to. So we give that back so you can get restful sleep. What's also cool about melatonin is not only does it help you get restful sleep, it also helps with your mood. If you have low melatonin, you get cranky and miserable. And for people who have autoimmune conditions like me, like my specific autoimmune condition, ITP, it actually helps you to have less autoimmune issues. And in my situation, it helps you like build more platelets. So you need it for lots of reasons. We're still learning so much about melatonin. And so even if you choose not to get this, I highly recommend calcium, vitamin D, chromium, and melatonin at the minimum. But this has 17 total ingredients that are all replenishing what prednisone is stealing and helping to counteract side effects by giving it back.
Absolutely. And I just want to add to that there are so many resources that can help with all of these things. And so in addition to these, there are some lifestyle modifications that you can do to help with the circadian rhythm that are so simple. I honestly didn't believe them. My background is holistic health, and when I started studying how the pituitary reacts to light and how really outside stimulus controls a lot of our hormones. So I want to just say that if you're adrenal insufficient, it's hard to keep a circadian rhythm because we don't have those normal hormones that are bursting and waking us up. So something that really helped me be able to have more energy, and also increased my vitamin D levels without me having to take anything, was making sure that I got light exposure. There's a lot of science that if you introduce light into your eyes, it activates your pituitary gland to produce those waking hormones. You have other hormones other than cortisol. So even if you're cortisol deficient, if you get that light exposure within your first 30 minutes of waking up, it's a game changer. And then also being in safe sunlight. Now, you don't want to be obviously like overheating yourself or whatever, but being in sunlight at least 15 minutes a day, just getting some sun exposure, on your body. Again, I'm in Florida, so I will burn easily. And I'm not saying go out there and put tanning oil on. That's not what I'm saying. I'm saying go outside and, sit in the grass. And that's a whole nother video about grounding. But we, like she said, the way that we are designed, the way that we are, is that we need these external stimuli to get our hormones to do what they need to do. So light exposure within 30 minutes of waking up is a game changer. And then getting that 15 minutes of direct sun exposure. Again, not talking about laying out there, not talking about anything like that, but just being outside, even in the wintertime. You need to have that. And then if you are unable to get outside, I highly recommend red light therapy. There are really inexpensive red light therapy masks that you can get. My red light therapy has increased my vitamin D levels to the point where I do not even need to take supplementation. And vitamin D is also a hormone. And so it affects your body's ability to manage cortisol. And it's like crazy how that's like a baseline thing that they don't talk about. So if you are on any sort of cortisol replacement, you definitely need to ensure that you're getting sunlight exposure. And if you can't, get an inexpensive red light. They have so many innovations available now. So I highly, highly recommend that. And then at night, like Megan talks about with melatonin is very sensitive to light as well. And so if you are constantly around these light sources, you're not going to get those triggers in your brain that tell your body, okay, we need to rest, we need to sleep. So something that's really been a game changer for me is if your bedtime is say 9-10 o'clock, turn the lights off in your house and put low lights on. You don't need to be around any like flickering stimuli. Like I try to turn all the lights off by 7 p.m. I use Himalayan salt lamps for low light. You can use candles, like whatever. It just helps send your brain a signal. All right, it's time to go to sleep. And it's going to take a while. You're not going to be like, oh, I can sleep immediately. But give it about 2 weeks and you'll start to see that when you turn those lights off, your brain goes, all right, this is a signal. And I can't stress enough how, that's made a difference for me. And it sounds crazy because it's a light. Like, how can a light do anything? But if you understand the way that our brains are wired, that's a game changer. So get some Himalayan salt lamps. They have other properties that are really helpful. They cleanse the air or whatever. And I don't sell them, so I don't know. But I have them in my house. I have them in every room. And it's been a game changer. So are there any other lifestyle tips that you have, Dr. Megan, for patients?
I have a whole checklist of lifestyle things to do. People can download it. It's called my prednisone checklist. It has everything from like light to like sleep hygiene habits. You've talked about a lot of them, but there's even more about how to get restful sleep at night, how to not gain weight, all that stuff like that. So I have my prednisone checklist. So you could download my taper chart, you could download my prednisone checklist, and you can get my product for free. Like I am throwing it all out there, guys. Like you're getting the whole shebang today.
Yeah, you see why we love Dr. Megan. She makes life better. But like she said, I will put all of the links that she sends me on the description of this video. And she also does consults or whatever. So if you want to schedule a time with her, like I have looked to her in so many days. I'll tell you a little story. I was trying to get on Rayos, which is like the newest steroid out there. It's like long acting prednisone. And I called her and I was like, hey, what do you think about Rayos? She's like, how did you get that? I'm like, I'm me. And so I really talked to her about, what to expect and whatever. And it didn't end up working for me because of stomach issues. But she had the knowledge to help me make an educated decision on whether that would be an option. And that is a great option for some patients. So I want to put that out there too, that if you're burning through cortisol very rapidly and having these ups and downs, talk to your doctor about Rayos. It's basically just a long-acting prednisone. So just always have those conversations. And, like Megan said, her website has a myriad of things. She's a doctorate. I mean, she has gone through this personally, and she also has the professional background. Anything she puts out there, she's researched and she's also experienced it. So it's something you can trust. And I think there's a hesitation when we present our doctors with things that they don't agree with, but that doesn't mean that it's not correct. It just means that they've never seen it. And then it becomes this ego thing of, well, that's, your Dr. Google. Well, no, these other people that have gone through this did literally get on Google so we could find this information. Thank you.
I just have to say really quick, a disclaimer. I can't figure out how to change the price. So it's $9.95. I told you $7.99, but I can't figure it out. So it's $9.95. I could send you a refund for $2 or something if that really matters to you. But it's not like I'm making money off of this. I'm not at all. So it's literally like I bought this product. I invented it. I paid for the product. You're literally just paying for shipping. So $9.95. I can't figure it out. Okay.
I feel like we're like that Billy Mays commercial, but wait, there's more.
Wait, there's more. But wait, I just raised the price by $2. Sorry. I can't figure it out. I'm sorry, guys.
It's like a reverse discount,
So $9.95, you're still, for a lot of you, that actually still isn't paying for your shipping. If you live in Alaska or Hawaii or Minnesota or places like that, you're still not paying for all of the shipping. So
that's so funny. So there's another question that we have here, and it says, how do you manage stomach issues? So like Dr. Megan talked about, I think the first thing she said was be sure not to take NSAIDs. So if you want to expound on that a little bit.
Yeah, I mean, step one is make sure you're not taking a drug interaction like ibuprofen, Advil, Motrin, naproxen, naproxen, any of those drugs. Celebrex, lots of options of things that can interact with prednisone. That's the number one cause of stomach upset. And then you could take Tums. Tums is basically calcium.
Yeah, it's calcium.
You're taking calcium. And so that's a great way to make the stomach issues go away and be giving your calcium back at the same time.
Yes, I never even thought about that. Just a disclaimer, if you have any sort of kidney stone, be careful.
Yes.
I learned that hard way.
If you have kidney issues.
Most of you don't have medullary sponge kidney, so you'll be fine. But
Yeah.
I think the point is make sure that you're checking drug interactions. You can go on drug interactions checker on I think WebMD has a section, it's drugs.com. I use that every day. Put it on your phone. Make sure that you know, because doctors are great, but there's no way they can know everything about everything. And that's not to their fault. That's just that they're human. So sometimes we have to go, and check for ourselves. So be sure that you're doing that. And then another note about the stomach, like I told you guys, I was on Rayos, and it's a long-acting prednisone. I didn't react well to it, and I actually developed H. pylori, which is this weird, I don't even know how to describe it. It's not a parasite, but it's this weird bacteria, and it causes gastric upset, and it was just a wild thing. And how I healed myself from that was I actually did a bone broth diet for about 90 days. And there's a lady called Sally K. Norton that has some great resources. She's just amazing. So if you want to find a good, really healing diet, it's a low oxalate diet, and it's basically a different version of the AIP. And one day we'll do a whole thing on keto and why that's not the greatest idea. But anyways, I think it's very important, especially as adrenal insufficient patients, to be careful what we eat. And the chicken broth diet was very good because we're salt wasting. And so it was very nourishing, and chicken broth has a whole lot of things. And you're not just eating that, but it's a baseline. And so, the recommendations are just get you a big chicken, like a chicken from the grocery store, put it in a crock pot and let it go overnight. You can season it with whatever you like. I do garlic and thyme and whatever, and then just let it cook overnight. And then strain the broth. You can use the chicken for a dish or whatever. And then drink a cup of that broth every morning. It's just something as simple as that. It really helps build back your stomach. And then there are, herbal things you can do. Marshmallow root really saved my stomach. And again, check with your physician, but those two things stopped that H. pylori, and I didn't end up having endoscopies and all that. And so I think we need to really, focus on our health first and try to find things that work for us. So I just want to mention that if you're having any stomach stuff, like Dr. Megan said, first check your drug interactions, and two, try to put yourself on healing protocol. So I'll put that lady's protocol in the chat box. Sally K. Norton is her name. So any other comments on that, Dr. Megan?
I can't think of any. I mean, stomach upset is such like a non-specific thing that you should check with your doctor, but try those things as well.
And then we had another question: lifestyle tips for adrenal insufficient patient working night shift. That's a tough one.
Oh goodness, good luck. I honestly think do whatever you can to mimic the cortisol of your day. Like whatever your sunrise is going to be, try to take your doses at that time. I but definitely work with your doctor on this one because you're very unique situation.
Yes, you're probably gonna have to do the opposite of the rest of us.
Yeah.
But that's where the circadian dosing is imperative, and you're gonna have to probably do the reverse thing. But maybe a longer acting steroid would be a better option for you. That way you're not having the bursts and the, whatever it might be, a slower transition. So maybe speak with your doctor about Rayos or prednisone or something. It's really individualized, like we've said multiple times, is steroid replacement. There are options, and that's why we fight so hard that people know these options, because hydrocortisone doesn't work well for everyone. It just doesn't.
Right.
And so I noticed that I opened a Pandora's box of keto not recommended for us. So here we go. Disclaimer, I have had the training to be a registered dietitian. I don't have a license now because I don't do it, and I don't see a sense in paying a license, but I do have the education. So I'm just going to put this out there. And again, everybody's different, but with keto, what do they always talk about? The keto flu, all this stuff. Keto messes with your electrolytes. Okay. If you have Addison's disease, you already have horrible electrolyte balance. As a person with dietary education and as somebody with this condition, don't do keto. Now, I know some people say, I did it and I did fine. That's good. That's awesome. And there are different forms of adrenal insufficiency. But when I did it, I ended up in the hospital. And it wasn't until then that I looked into, okay, and if you look at, like, I always compare Addison's to diabetes because it's a very similar disease. The diabetics, they can't completely go without carbs. Are they low carb? Yeah. Do they watch what they eat? Yeah, but they can't do that either. And we had Dr. Karen on the day before yesterday, and she talked about that, the need for carbs. Carbs are a quick energy source for the body. Okay. And when you have severe adrenal diseases, when you have conditions that stress your body out, when the body gets under too much stress, it does this thing called downregulating. And digestion is part of that downregulating. So when it's already stressed out and when it already feels like something's wrong, it's not going to digest as well. So when you're only feeding it red meat or some sort of butter coffee or whatever other disaster keto tries to tell you that you need, you're going to feel awful. And I'm not saying that it's everybody. Everybody's different. But during my training, I had to study every single diet there was. I've probably been on all of them, and I can tell you for the adrenal insufficient community, I cannot, as a personal, with this condition or professionally, recommend anybody with primary Addison's, going on keto. It's too dangerous with your electrolytes. And also intermittent fasting. Okay. That is the rage. When I was young, breakfast was the most important meal of the day. And now they have turned it into wait as long as you can without eating before you pass out. Like I don't know why.
So yeah.
Yeah. And I'll let Dr. Megan expound on this. Your body has a stress response, right?
Right. I mean, so I think keto and intermittent fasting might be great for people like who are taking prednisone for rheumatoid arthritis or something, for like an autoimmune condition, and they're not steroid dependent otherwise. Mm-hmm. It might work for them. And so you might be hearing in, communities, you're hearing that they're saying that it's working for them. Great. But they have functional adrenal systems.
Absolutely.
And so it's a totally different conversation. Like it just is. Like if you are adrenal insufficient, that's a lot of stress for you to be dealing with. And so unless you've got the blessing of your doctor, I wouldn't mess either.
Yeah. And,
And I have to go. So it's been fun. Check out all of my free downloads and free product. And I am going to sign off.
thank you, Dr. Megan.
Prednisone pharmacist. Bye.
We appreciate Megan so much. Thank you.
You're welcome. Bye.
Okay, so that was Dr. Megan, and I will close with these things just to finally answer that question. With intermittent fasting, it's very stressful to the body because then it goes into these reserves. And the thought is, okay, if I don't eat, then my body's going to pull from these fat reserves and you'll lose fat, which in a normal, person without adrenal insufficiency, it might work fine. But when you have, adrenal disease, if you're post-Cushing's, if you've had a BLA, whatever, your body probably has created this thing called adipose tissue. And adipose tissue is actually an extension of your endocrine system. Okay. So what that means is it's more than just fat. It's literal endocrine cells that have sensed that your body isn't at full strength with your endocrine system. And so when you restrict and your body is saying, I don't have enough food, it's going to hold on to the adipose tissue even stronger. And then also when you do have cortisol deficiency, you don't have the same relationship with glucose and things because they're cofactors. And I won't get into the technical things, but unstable blood sugar is not a good thing when you have an endocrine disease. So I would say definitely use caution if you are going on any intermittent fasting protocol. And like I said, I have had the training to be, I have had extensive training. I'm not currently licensed because I don't do it, and there's no sense in me paying for a license that I don't use. But I do appreciate everybody tuning in. This has been a really good conversation, and I hope that we are able to have more of these. If you have any other questions or anything, feel free to comment below. We will try to answer them as we can. We are still recovering from Hurricane Ian, so we're in a temporary office still, but we are still so grateful to be a part of this community. And be sure to tune in Monday, December 5th for our live demo with Solution Medical for the Twist Check device. So I thank you guys so much for being a part of this, and Merry Cortisol Christmas.